Navigating ethical dilemmas and maintaining professional integrity in nursing. Introduction to ethical practice. Welcome to ethical practice in nursing. Ethical decision-making forms the foundation of professional nursing practice. Today's focus areas include understanding core ethical principles, navigating complex ethical dilemmas, maintaining patient confidentiality, making sound ethical decisions in challenging situations. Ethical practice requires adherence to legal standards, ethical principles, and professional integrity while maintaining the highest standards of patient care. Understanding ethical dilemmas in healthcare. Ethical dilemmas arise when conflicts exist between fundamental principles. Common conflict areas: autonomy versus beneficence, individual needs versus resource allocation, patient wishes versus family preferences, professional obligations versus institutional policies. Challenging situations include end-of-life care decisions, resource allocation during shortages, conflicting treatment preferences, disclosure of sensitive information. Core ethical principles in nursing. 6 fundamental principles guide ethical nursing practice. Autonomy. Respecting patients' rights to make informed decisions. Supporting self-determination. Honoring treatment choices, including refusal. Beneficence. Acting in the patient's best interest. Providing compassionate, quality care. Promoting well-being and healing. Non-maleficence. The fundamental duty to do no harm. Preventing injury or suffering. Minimizing risks in all interventions. Justice. Ensuring fairness in healthcare resource distribution. Providing equitable access to care. Treating all patients with equal respect. Fidelity. Keeping promises and commitments. Maintaining trust in nurse-patient relationships. Following through on care obligations. Veracity. The obligation to tell patients the truth. Providing honest, accurate information. Maintaining transparency in communications. Ethical decision-making frameworks. Systematic approaches help navigate complex ethical situations. Ethics committees. Provide guidance on complex ethical situations. Offer interdisciplinary perspectives. Support decision-making processes. 4-box model components. Medical indications and treatment options. Patient preferences and values. Quality of life considerations. Contextual features affecting decisions. 5-step decision-making process. Identify the ethical dilemma clearly. Gather relevant information from all sources. Explore available options and alternatives. Make an informed decision based on ethical principles. Evaluate the outcome and learn from the experience. Understanding and addressing moral distress. Moral distress occurs when nurses know the ethically correct action but face barriers preventing them from acting. Common causes. Institutional constraints limiting options. Resource limitations affecting care quality. Conflicting directives from different authorities. Family or patient requests conflicting with best practices. Management strategies. Access moral distress consultations. Seek support from ethics committees. Engage in peer discussions and debriefing. Pursue professional development in ethical reasoning. Collaborating with interdisciplinary teams. Ethical dilemmas often require collaborative approaches. Team members include physicians for medical expertise, social workers for psychosocial considerations, chaplains for spiritual support, legal advisors for regulatory guidance, nurses' role in team ethics. Ensure patient values are represented. Advocate for patient preferences. Provide clinical insights from bedside experience. Facilitate communication between team members. Maintaining patient confidentiality. Protecting patient information is both an ethical obligation and legal requirement. HIPAA regulations. Safeguard all patient health information. Limit access to authorized personnel only. Ensure secure storage and transmission. Practical applications. Use secure electronic health records. Avoid discussing patient information in public areas. Protect patient privacy during conversations. Secure all documents containing patient data. Consequences of breaches. Legal action against individuals and institutions. Loss of patient trust and confidence. Professional disciplinary actions. Financial penalties and sanctions. Exceptions to confidentiality. Certain situations require disclosure of patient information. Duty to warn. Report suspected abuse or neglect. Notify authorities of credible threats to others. Protect vulnerable populations from harm. Public health reporting. Disclose communicable diseases as required. Report foodborne illnesses and outbreaks. Comply with disease surveillance requirements. Involuntary commitment. Share information to protect patients from self-harm. Support mental health evaluations when necessary. Collaborate with mental health professionals. Ethical considerations in end-of-life care. End-of-life situations require careful balance of ethical principles. Balancing principles. Respecting patient autonomy in decision-making. Providing beneficial comfort and pain management. Avoiding harmful or futile interventions. Ensuring fair access to palliative resources. Important documents. Advance directives specify patient wishes for future care. DNR orders indicate preferences regarding resuscitation. Healthcare proxies designate decision makers. Care approaches. Palliative care focuses on comfort and symptom management. Hospice care provides compassionate end-of-life support. Family support includes grief counseling and bereavement services. Managing moral distress. Seek support through ethics committees. Access professional counseling services. Engage in peer support groups. Pursue continuing education in end-of-life care. Legal and ethical considerations in assisted death. This complex area requires understanding of legal and ethical implications. Legal variations. Laws vary significantly by country and state. Some jurisdictions permit physician-assisted death. Others prohibit all forms of assisted dying. Ethical considerations. Balancing patient autonomy with professional obligations. Considering quality of life and suffering. Weighing societal implications and precedents. Nursing responsibilities. Understand legal obligations in your jurisdiction. Provide compassionate care regardless of personal beliefs. Support patients and families through difficult decisions. Seek guidance from ethics committees when needed. Ethical practice excellence. Ethical practice requires continuous learning and reflection. Key takeaways include: understanding and applying core ethical principles guides decision-making. Systematic frameworks help navigate complex ethical dilemmas. Confidentiality protection is both a legal requirement and ethical obligation. Collaboration with interdisciplinary teams strengthens ethical decision-making. Ongoing education and support help nurses maintain ethical integrity. Thank you for watching. These ethical foundations will support your professional practice throughout your nursing career.